Hello, thanks for joining me. This is a live video, but anybody that watches it retrospectively, please feel free to comment as you watch the video, because I will get the notifications and I will come in and answer any questions that you might have afterwards. Okay, so this is the third live that I've done. The first was on ovulation methods and all the different methods, what's available, which ones I felt were better than others. The second was specifically on progesterone testing, and I said I was planning to make 2 girls, and I wanted to give you an update on the progress. Please hit the likes and you know, thumbs up and all that kind of thing as we go along, just so I know people are joining me, which they are, which is great. But yeah, so I want to spend this session just to give you an update on my 2 girls that I should have done 2 weeks ago, but I've just been really busy. I apologise in advance for my voice. It sounds like I've got cold, but I'm suffering hay fever bad this year, which I do get it, but normally not this bad. So hopefully I don't have a splutter of coughing session halfway through talking through this. But hello, thank you for joining me, Jill, Maria and Stacey. So yeah, I'm going to give you an update. I have got my scanner all rigged up to go. Hopefully you'll be able to see the images. I'm going to talk you through what I'm doing and that kind of thing, but what I can do anyway is load up the images afterwards. It's just quite hard to get the right angle from one screen to another, but yeah, I'm going to talk you through the updates of my 2 girls. So you remember I had dog 1, Patsy, which you saw me do the cytology in the first video. And she was the first of my 2 dogs to be mated. She was actually mated, let me just look at my stats behind me. She was mated on day 10 of her season. She was 16.2 nanograms, which is a mate immediately, and I mated her the following day. And then her mum, who I also mated, she ovulated roughly day 6 of her season. I was guessing because I've got multiple pictures and I wasn't quite sure who had come in and who come in which order. So I was guessing she was day 6. So I basically, as soon as I saw blood, I tested her and she was really low. So I took it that she was probably only day 1 or 2. The mother is slightly problematic. Her first litter she had, I used my own stud dog. She didn't even leave the house. And she only had 2 puppies, of which the daughter is the one that I've mated as well. So she only had 2 puppies, which, you know, is not great, but not end of the world stuff. She hasn't had a season, as far as I was aware, until mating her this time. So, you know, her daughter's now 22 months. I generally, my dogs don't suffer from silent season, so it's slightly unusual. She may have had one. Again, if you've got multiple dogs, it's quite difficult to keep track of. I think she's probably so put off by having her first litter, she was just avoiding having a second. So with her, because she is slightly a nervous female, and this is where it's good, you've got to know your girls. So with her, she has not been walked since I've mated her. All the rest are all fine, and her daughter I mated, she's had her usual walking routine, but because she is quite a nervous female, I thought it's just best to have a low stress, and that's it. Once you mated them, you just want to keep everything nice and calm, your normal routine. Even on the actual mating, the sperm of the head takes 6 hours to change to be able to then actually get through to the egg. So even though you've done the mating, they're still not going to conceive at best 6 hours afterwards. So I always say to people, just have a really quiet, super evening. You know, your usual routine, no extreme exercise. So yes, she should go out for her usual walks, but no crazy long runs, or, you know, just letting her bounce around off the sofa non-stop. You just want to keep everything cool, calm and collect. Okay, so there are various methods to try and work out whether your female is pregnant or not. And the first one, which I'm sure you've all seen flying around on Facebook, is checking whether the gums go paler. I think it's at 21 days, whether the gums go paler or not. And I see all these pictures on Facebook of people taking pictures of their dog's teeth and gums and trying to work it out. I don't know, some say it works, even if it, I don't know, you know, on a different day she's eaten or not, and blood circulation and all that kind of thing. I'm not sure it's a hard and fast rule to go by, and even if it was, it doesn't give you an idea of what to expect, and obviously it doesn't mean it's a viable pregnancy either. So I don't know, if you want to participate you can, but I'm not going to recommend that one. An old school one is actually feeling for pups. Vets are meant to be the pros at it. I'm sure there's some old school people. I always wonder about this one, because I think, well, if you don't know what the bitch felt like before she had puppies, how are you going to know what she feels like when she has got puppies? And feeling the lumps and bumps. I don't know, maybe on a whippet is possible, but on a bulldog, Great Dane, I don't know, Newfie, I think you'll be hard pressed to be able to feel whether there's any golf ball lumps and bumps, or even that they're like 1.5 centimeters. I wouldn't waste your money. I know some vets charge for this procedure, and I really personally wouldn't waste your money for what they charge for a consultation. There's other methods available. You've got pregnancy tests. So some people use human pregnancy tests to find out whether their female's pregnant. This will not work for dogs because their hormones are different. You can actually buy canine pregnancy tests, so your vet can actually source them. I think they're quite expensive. In America, I think they're more likely to use them, but they're probably more likely to do everything over there compared to us, because they're just a bit more switched on and a bit more advanced because of the distance they have between their stud dogs and their females and all that kind of thing. You can buy them, I think they're called relaxing or relaxing kits, relaxing probably. There is a website that sells them. They work out quite expensive. You have to buy like 6. The problem with them is actually not a wee test. Is actually you need a blood draw. Again, you're testing, I believe it is a serum, or it might be whole of blood, but it can give a false result up to 35 days. So it might say that she's not pregnant and she is, and vice versa. So generally you're not going to find out anything super early compared to other alternatives that are available, and also it doesn't tell you whether it's a viable pregnancy, and likewise doesn't give you an idea of numbers either. So it's there, it is available, but it's not accurate. So again, I don't see the point. Oh, there we go. Yeah, so Ollie said, yeah, from Norway, he remembers it being an inaccurate test. Yeah, so it's not reliable, but it is there if you want to have a look it up and find out more. I know a few people use the Doppler heartbeat sort of microphones that you can buy. I think sort of mums sort of use them when they're pregnant, probably first time mums as a novelty, probably not much after that. I think I did buy one in the past. I had no joy with it. All I was picking up was the blood flow of mum. I found it really difficult to use. I did speak to a show person actually a few shows ago, and she swore by it. And she said you have to put like the little sensor right down by the teats and over by the teats. And again, you need ultrasound gel because the gel blocks the air. So you're hearing directly from internally. There's no interference straight into what the microphone that you're hearing. As I say, they are cheap. Some people give them a go. I don't think anyone lasts very long with them. And I don't know if the Draminsky, I talked about the ovulation detector that they use. They also have brought out some kind of pregnancy detector. And scarily, I've seen people offering both of those services and charging for them, which is a little bit concerning. But again, ask any questions as we go. So I've got a great number of people with me, but please feel free to ask any questions or interject as I go along. But yeah, so these Draminsky pregnancy detectors, again, I'm not quite sure how they work. I guess it's probably same as the Doppler principle. I won't waste my money on those either. Yeah, Jill says she's got a Doppler if anyone wants it. So yeah, it says how good they are. Another alternative, well, I would say the main alternatives that we have in England is ultrasound scanning, and it's what I'm involved with, and I'm going to talk you through why I think that's so good. But we have also X-raying, and in America they do it a fair bit. I hadn't heard of too many people in England, but actually since sort of having discussions with people, there are a few breeders that I come across that had previously X-rayed. Now with X-raying, there's no point X-raying until bone formation. So you're waiting until at least 45 days to be doing an X-ray. And obviously an X-ray, as you know, when you go to the dentist and they take an X-ray of your teeth, or if you're lucky, you've never had that, but I certainly have. They all run out the room when they do the X-ray, and they wear those leaded aprons and that kind of thing because of the rays that they're sending through your body. So I'm not quite sure that would be my preference when I want to find out whether my female is pregnant or not. And also, you've got to take them down to the vets. You're probably going to have to leave them at the vets in an environment that I personally wouldn't want my pregnant dog being in, because all the germs and other sick animals that are there. I know some people say it's more accurate. Well, again, I'm sure you belong to some of the same Facebook groups as me when it comes to whelping and rearing. They're still posting out images saying, can you see how many skulls there are? And they're trying to guess, because the images that have been caught aren't particularly very good ones. I know also the argument for X-raying that is preferred is that you can measure the heads and then measure the pelvis, and then know whether the female will be able to pass that puppy. Again, I don't see too many, though. You have to take the X-ray from 2 different angles to be able to do that, and I only ever see people posting up one angle, so it makes me think that no one's actually measuring anything. And from experience, generally it's not the head that's the biggest bit anyway. It's a bit like humans, it's with the shoulders. With the dogs, it's the shoulders and across the ribs, so they're probably measuring the wrong part to know whether it's going to pass through or not. So I don't know if anyone else has got any comments on X-raying, whether anybody here has actually had an experience with it. It'd be good to sort of chip in. But my preference for how expensive it would be, particularly in England, I think you're probably, if you're lucky, you're looking at 50 quid, probably an image. So for £100 plus the stress of taking her to the vet, I wouldn't want to sedate her. So whether she's comfortable enough to be taken without sedation and that kind of thing, then to me, it's not really an option that I think is feasible. But I know it does happen. It is there. Yeah, so Helene, she's got ultrasounding on the 24th, and she's actually from Sweden. So to say it's a well sort of recognised, and less in America actually, but I think it might be because of certain legislations they might have or not. So we are quite fortunate, if that's the case in England, that we can ultrasound our females. But what I'm sure you're all aware of is there's people popping up here, there and everywhere. And it's quite hard to know who you should be going with, who you should be paying your money to, what's a good price to be paying. Because I can tell you now, cheaper isn't better. Because normally the cheaper they are, it's because the less experienced they are. So they feel they shouldn't be charging too much in case they get it wrong. I think I scanned just under 1,300 dogs now, and I think I only had one female, and that was actually a bulldog that I said she wasn't in pup. We scanned her at 28 days, very thick set show bulldog. I said she wasn't in pup. They sent me a picture when she was late 40s, early 50s with huge teats. So I said, no, bring her back, I'll scan her, because unless she's having a serious phantom, then it's, let's have a look at her. And yes, she did have one puppy, and unusually a solo pup would be carried right down in the centre. But this pup was actually carried up right at the end of the horn and right next to the kidney. And actually, unfortunately, that puppy ended up being a water pup, and so it didn't end up being a viable puppy. But of all the scans that I've done, and that was a very unusual one, because they say solo pups generally are held actually low. They're never at the end. There's no reason for them to be at the end of the urine horn, because they don't need to share with anyone. Okay, so you've got to think it's a bit like a wishbone. So you've got the body here, and then the horns that go off here. Okay, and sort of when you AI, you put the semen to here. It's still got to get through the cervix and all that kind of thing into the horns, and then the eggs are up here, ovaries up here, and they travel down, and then they get fertilized by the sperm that's come in. And what they do, they know to space themselves out evenly. They know. So if they're overcrowded, they just won't settle into the lining, and they'll be absorbed into the body. Okay, so it's quite clever that so generally females will only carry a litter as big as what they're physically possible to carry. the bigger the dog, the longer the horns, the more likely they're going to carry more puppies, just because they've got the room to do it. Okay, which would make sense. And I think Jill, that's watching, she's the biggest litter that I scanned. That was 15 puppies, and they're saying I scanned down to 1. So it all depends. But the bigger the dog, the longer the horns, generally the bigger the litter that they can carry. Doesn't mean they're going to carry it, but it means it is more possible. So yeah, so that's just. Is kinky tails caused by big litters? Oh, that's an interesting question. Oh, I don't know if I could answer that, but yeah, you're right, because the bones are particularly in bulldogs, there's a lot of bulldogs that are born with twisted feet, so they're back to front, and it's just because the more puppies, the less room, they're trying to grow in a restricted space. And they're just going to fit any way they can. You'll get some puppies, you know, and it's the same with babies. They've got these weird cone-shaped heads, and they're just growing in the space that they've got. And normally, once they're born, normally after 3 or 4 days, you can see just the bones are starting to harden, but they harden to the correct shape. And the feet turn around. So don't ever, if you ever get a puppy born with back to front feet, particularly the rear legs, don't ever have it put to sleep. Vets will say, this is deformed, you need to put it to sleep. Don't. It will come right in a few days. And I guess, yeah, the same principle is with the tails, because I've got bulldogs, we don't have particularly long tails, but I guess, yeah, it's the same. If there's a long tail, it's only going to squeeze in the room that there is, but you would think that it would right itself as soon as the bone then hardens. But I guess, yeah, it depends to what degree. So I think there's probably is something in that, that the bigger the litter, the more chance you are going to get, just because of lack of space. Okay. But yeah, so to me, ultrasound scanning generally, it's a massive thing at the moment. Well, I probably think it's a massive thing because I'm involved with it now, but it's definitely more available than it was years ago. So I remember I used a lady called Sam Wilkinson. She's amazing. I never ever say a bad word about her, because she is as best as you're going to get in this country, without a doubt. She's worldly recognised. She scans in New Zealand. She absolutely knows her stuff, and she used to travel the length and breadth of the country. But she wasn't cheap, especially if you did live near her. In Brighton, she got pretty expensive. And then obviously the technology now has come along. You've got flat screen scanners. They're more portable. So sort of the idea of actually, instead of, you know, one person lugging everything around, there's a few more people that can do it now. It's more accessible. But what you have with that is people not knowing what they're doing. And Sam and her family, I think her dad was a scanner, her sister's a scanner. It is born and bred, it's in their DNA. And what we've got, unfortunately, at the moment is people that, some of them having bred litters, but they might have bred 1 or 2 litters, and they think, oh yeah, let's give it a go, I'll buy a scanner. And they always say, oh, I'm only doing it just to scan my own, and then they start scanning friends, and then they start, you know, scanning more than that, which is fine. If you've just got to let the people know, if you're not experienced and you're not confident, then you can't be charging money, because you're going to get it wrong. And I know I work within a close group of scanners, and that's, if you want to find a good scanner, there's a website called www.findascanner.co.uk, where we're all trained to the same level. We're pretty much a good network for each other. If we get you're always never going to know 100%, but you can get the odd scam where you just go, oh, I don't know, this is unusual, this isn't right, and we run it past each other and see if anyone else has had that experience or not. So we're always trying to upskill, and we're always learning from each other. If you've got someone that's just bought a scanner, they scan their own, they got it right, they haven't got it right, they might be able to detect pregnancy, but there's also other things to pick up as well. They're probably not particularly accurate with numbers, because, as I say, as with anything, is experience. The more you do it, the better you get. It's like driving. When you first pass your test, it doesn't mean you're any good at driving, it just means you pass your test, and what experience comes afterwards. And that's the same. You know, the scanners that I know, they do this stuff day in, day out. They probably could do it with their eyes closed if it's possible. So I always just think, you've got these they've all got Facebook pages you can have a look at. Just look at the quality of the images. When I'm scanning, people start counting the puppies before I've even confirmed pregnancy, because what I'm doing is I want to check is a viable pregnancy first before I get everyone's hopes up of, oh great, you got puppies. I just want to check that actually, does this look all normal, does it all look good, before I start saying, yeah, she's pregnant and everything's okay. So yeah, look at the quality of their images, look at their feedback. I know now most people that I would recommend, if they're not in my area, you know, if the scan, someone's inquired and not in their area, they've probably got 80, if not 100, if not more, feedback reviews on Facebook, because they're scanning that much, and then they're that good at what they do. Anyone less than that, I'll be quite doubtful of it. And likewise in regards to cost, yeah, so funny enough, yeah, how much is it for a home scan normally in the UK? In the UK, I would say anything from, as far as I'm aware, 35 probably to about 85 quid. It all just depends on the mileage that that person's covering, the more expensive it gets. Again, also your location. So I'm based down south, and as with everything's more expensive down south. So south and southeast, we probably charge a bit more than what you do east, Midlands, north. But please, all I can say is please just don't decide on who you're using because of cost, because and I get it, I get called out to scan, people didn't know I existed, and they have had a scan by somebody, they obviously didn't feel very confident with what they said or the information they've been given, and then they found my number, and then I've had to scan their dog just to check that what the person before said was correct or not. So if that's the case, you're paying twice anyway, so you might as well just pay one person a decent amount. And as I say, I'm sure if you breed a lot, you'll build up a rapport with those people, and I'm sure, you know, all I can say to people is just, we get busy, so make sure you book at least. I love the people that say, I've mated him a bitch. Like literally, they've texted me on the way home for mating a bitch, and they're saying, can I book him for my scan? Because that means they always get the best spot. You know, they always get the time that they want and the date that they want because they've booked so early. The people that last minute go, oh, I need a scan, it's all emergency and all that kind of thing. Well, you have to fit in with the people that have made the effort to get in, you know, when they did. Likewise, I have people come to me. So some people, if they're local, obviously it makes more sense for them to come to me. Then as soon as I step out the door, it's going to cost them an extra £10. So I always say, if you want to come to me, but I understand people have got females that aren't good at travelling and that kind of thing, so it's fair enough. Okay. So in regards to the ultrasound itself, it is as safe as you can get. You know, with humans, you have various scans during your pregnancy. I couldn't tell you how many because I haven't got kids myself, but you have various scans throughout your pregnancy. No one evacuates the room while they're doing the scan, because the waves that are used are safe waves. People ask me, is it dangerous? I hear stuff on Facebook about puppies being reabsorbed after scanning. It probably wasn't a viable pregnancy and it would have happened regardless. Okay. But just putting it out there that it's, for me, it's as safe as it could get. I imagine you would have to leave the probe in one area for like 6 hours for it to cause like electrical heat that would unnecessarily heat that area, that would then impact, you know, could negatively impact the puppies. It doesn't mean it's gonna. Okay, so for me, it's safe. If you've got someone that's good at what they do, they can tell you that it's a viable pregnancy. Generally, I recommend that you scan 28 to 35 days from the last mating. Okay, so some people get impatient, go too early. You could scan at 21 days, see nothing. You think your bitch is an impup, and when actually she is, because the eggs don't implant into the uterus until 18 to 21 days. Okay, and then they're going to then be visible on the scan. So it doesn't pay to go early. 28 to 35 days is best. Some people prefer over 35 days, but you're counting your numbers is going to be less accurate because they're bigger and they're touching. And when you scan, we can only scan from the bottom up, and we can look around the sides a bit, but we can never go 360 and look down and inwards and double check our numbers. We're only scanning like 180 degrees really. So the bigger they are, the harder it is for us to give you numbers because they're touching. But absorption is possible up to 35 days. It can actually happen after that, but the most, if it's going to happen, it's going to happen up to 35 days. But generally that would be present, and you would be able to see something isn't not quite right from the 28 days. So to me, most breeds are good 30 to 32 days. I've only had 2 reabsorptions that I'm aware of. Obviously people don't tell me, then I don't know. One was they dropped the dog. It was a solo pup and they dropped the dog, so that's no surprise there. And the other was actually, we scanned her at 35 days, but they had a house move and she did get significantly stressed over the house move. And they called me, they said she's full term. I went to them, I looked at her and I thought, well, she's still in pup, she's still quite big. They said she's got milk, she was having discharge, but she had absorbed them. They just said she's gone over and just doesn't feel quite right. And I was shocked because to look at, you would have thought she was still in pup, but she had absorbed them. So it is rare, and I see all the posts on Facebooks about absorption, and I just generally personally think that the person scanned bowel and never got it right in the first place. So because just of the dogs that I've had, it is pretty low that I come across it, and some breeds are more prone to it than others. It's not really all breeds suffer from that issue. Okay. Any questions, please feel free to ask as we go. So what I'm going to do now is I'm going to conduct a scan and just talk you through what I'm doing. I'm conscious that you might not be able to see the images properly, but I can post some videos up afterwards. Okay, actually what I forgot to mention to you in the last video before I do the scan was about supplements. So I said I mated my two females. What I generally do, and you'll see again lots of Facebook groups, there's good discussions happening about these things, about vitamin E. I never previously given vitamin E, but I do now, because I do believe that to have particularly wheat germ oil is a natural vitamin E. And it's just an antioxidant for the reproduction organs. So I think it's never going to do any harm. For what it costs, it's worth having. So I would definitely recommend vitamin E way before she's even in season, and just keep her on it until the pups are born. But if you've got a female, maybe one that's had small litters or has problems in the past, then I definitely use vitamin E. I am going to do a separate video on picking studs, which I said I was going to do before this one, but I was so slow doing this one. This one's been my priority. But I'm also going to cover about other vitamins and supplements and that kind of thing. But generally I say don't do anything, keep it basic at first. I would do the vitamin E and I would do folic acid, which I'm going to talk about, but I wouldn't give any antibiotics and this, that and whatever on a maiden bitch. Take it that it's all going to be good. Just do some basic supplements because you want her in the best condition. Then if she misses, then think about, okay, what can we do differently that we didn't do before that's going to up her stakes of pregnancy? And it's not just supplements, it'd be, looking at your stud dog and that kind of thing. So yeah, just to bear that in mind, so that don't do too much. But I have got here, I do give folic acid. See that? Give this one, which I think you can get on eBay or Amazon. I can post a link to it anyway. But it's been proven specifically for the brachycephalic breeds, so all your short-faced breeds, how their muzzle develops is different to any of the longer shaped dogs, muzzle dogs. And the way that it forms, there's a lot going on in a small amount of space, that there can be deformities. And I'm forever seeing posts about cleft palates and tube feeding on Facebook. So for the sake of, Royal Canin wrote a paper on it, and again I can post you the link to it. It's worth a read, even if you hate reading, which I do. It is worth a read because you will learn something, but it's worth putting your female on folic acid. But this is 5 mg. The stuff that you buy in the supermarkets won't be strong enough. I think you have to give, like a bulldog, you'd have to give 12 or 15 a day. Okay, so you need the high strength stuff, which you're not going to buy in the supermarket. You need to get it online, and it is literally one tablet. I think it's from their season all the way through to use the bottle up or until the pups are born. But I just think 15 quid or something this is worth. Like the heartache of having to rear a puppy with a cleft palate, which I personally wouldn't do, but I know there are a lot of people doing it. The heartache that it is for this, just buy some of this and give it a go, and hopefully you're at least reducing your chances. What's the question? Do you give folic acid? Yep, so I just covered that. Yeah. First litter normally bigger or smaller? The only thing that it comes down to in regards to litter sizes is how many eggs your female releases, and I think vitamin E will help with that, and how fertile your stud dog is. I do scan a lot of misses with a maiden, and then they do exactly the same over again, and she catches. And I actually think that's due to her mental development at that point, where she's probably been quite immature and she's the baby of the family and everyone's mothered her. She's not mentally in that place, and she goes and has a mating and she doesn't really know what's happening. She doesn't understand it, and it all comes a bit of a shock. And I think they're just mentally not in that place, so they don't catch. But the second time they do the same again, because they made the stud feed probably, and they're going to go back to the same dog, and they do end up actually catching. And I think that's just because the second time round they're like, I know what this is now, I know what's going to happen, and they're just mentally more in the same space. But whether that, I don't think that impacts the litter size. I just think I do see maidens miss the first time and then catch perfectly fine the second time. Litter sizes, yeah, I couldn't say. I don't know. It's open to discussion what other people think. Feel free to comment whether you think litter sizes get bigger after first litter or smaller. I haven't seen any pattern personally myself, but other people may have. Yeah, so Angie said, yeah, first litter she had was 11, second was 2. Jill, first litter 15, and second 11. Yeah, so first 5, second 8. Yeah, I don't think there's particularly a pattern myself personally. Okay, but yeah, I just wanted to mention those two. Folic acid, would I give it to all breeds? Yes, I would, because it's recommended for all women. But I just think there are some breeds that benefit from it more than others, and they'd be crazy not to do it. Tracy said, my whippet is 16 months and still not had a season. Yeah, I must admit, my dogs generally are quite good. They're every 6 months, but I did have Patsy, actually, funny enough, the one that we're going to scan today, she went 12 months for her first season. I wouldn't be overly worried, but again, it would be worth probably putting her on some vitamin E, just in case there's some imbalances, and the vitamin E will just help to sort of detox it, maybe kickstart and get it into gear. But I wouldn't be massively over worried, to be honest, because she may have had a silent, or her first was that light that you didn't notice, and so I wouldn't be hugely concerned. Okay, right, so let's get on to the good stuff. So I'm going to have to jostle around as usual with laptops and that kind of thing, but I'm going to get Patsy up first. Right, Patsy, good girl. That's it, come in. That's it, you come round. That's it. Good girl. Right, so hopefully, so when it comes to ultrasound scanning, I always scan with them standing up, because generally most dogs are comfortable on all 4 feet. If it's a smaller dog or a cat, then generally they will lay on the owner's lap, belly up, and we can scan them that way. Likewise, Datsies, they've got diddy legs. You're not going to be able to get the probe in underneath. But generally, most dogs are more comfortable just standing up on all 4s. Okay, I've found if they are laying down, then obviously the puppies that are sitting here are going to slide back towards the spine, so they're less likely to be accurate in your numbers, really, and they're harder to see. Okay, anything help? Okay, so the scan standing on all 4s, it is a case of ultrasound gel. We use the gel because it blocks the air. Hopefully Patsy's going to be super good for me. I don't know, you might be able to see she's got a bit of a belly already, so she could be giving the game away. But yeah, lots of gel. Again, having your girl scanned at home means it's low stress, no dramas. Most scanners are experienced with all different breeds. Yeah, she might be giving it away now. Experienced with all different breeds, and you know, some bitches react differently. Some are barkers, some are nervous, all that kind of thing. But if you're using someone experienced, then they're used to dealing with those kind of females. Now, let me just do my patient. All right. Now, when you're seeing a scanner, you probably can't see it at all, can you? Okay, I'm going to talk you through it anyway. When you're scanning, oh, what's this? What day is Patsy? I believe she is 41 days. So I've left it way out of the recommended 28 to 35. Her mum is 4 days afterwards. So she's, what's that make her? Oh my God, quick maths. 37. So she's only just after. But obviously I have already scanned them and I do know the outcomes of them, but I've just not got round to actually showing you lot. But what you've got to think of is when you see a scan happen, they're gonna, oh, she's creeping around, hang on. They should be scanning from the bottom, so the bladder here, all the way up. Okay, so they're going to scan up and down, and then hopefully scan round this way, and it's going to scan round that way. Okay, and have a good look all over this area. I always hear, oh, my breed carries puppies in the ribs. Well, no horns end up in the ribs, so that's a load of rubbish. But the longer the horns, obviously the further up the body, and you can get them carrying them literally on the edge of the rib cage, but they're not in the ribs because you've got a diaphragm there anyway, and it's going to stop any organs moving from one place to another. And the lungs are generally in the ribs. So that's a load of rubbish, but you do have to have a good check over of the whole body. Okay, you can see, oh good, okay. You do have to have a good check over the whole body. All right, and as I say, that dog that I scanned with a solo pup normally would be here, and it was actually sitting here. So for some reason it hadn't migrated down, and I think because it was sat by the kidney is probably why it ended up a water pup, because it's quite unusual. Okay, but when it comes to the screen, I think you can see it all white at the moment. I'm seeing a lot of pictures on Facebook, and they're like tiny little circles at the top. The scanner, if they're skilled, will zoom in, and the whole point is that you make those as big as possible. When you're counting, you might want them quite small because you want to see a lot all at the same time, so you don't double count. But they should be zooming in and making it as big as possible. If they can't even zoom in on their scanner, you probably shouldn't be paying them for what they're doing. Okay, just to give you an idea. I had a scanner say that she had lots of gas, so couldn't see pups. Yeah, I don't believe that either. The only thing that might obstruct pups is a full bladder. So I did actually have a giant schnauzer, and literally all I could see was their bladder. And I said, you have got an app up there, because I could just about see it. But I said, will she empty her bladder? They went out, she did, and then suddenly they had a litter of full. So the bladder can. So with humans, we say, like they generally say, you want a full bladder because it's, well, I think it's just makes it an easy place to find, and then I don't think necessarily improves the images that you get, but for whatever reason, I don't know if it pushes the baby up or what, I don't know. But with dogs, I actually prefer an empty bladder, as empty as possible, because then the puppies are sitting, they're not pushed out the way. And as again said, I can't scan from the top down, I can only scan from the bottom up. So for me, I personally prefer an empty bladder. Yeah, see with gas, I generally say to people, don't feed them an hour before I scan, but I wouldn't say that it makes any difference to me actually doing a scan. It just makes it probably uncomfortable for her to be scanned, for me to be prodding and poking around with a full belly. I personally don't think it would make much difference. And actually you can pick up the gas because it's all quite sparkly, it all sort of shines and it is quite sparkly, but it won't, to me personally, I wouldn't say it would get in the way of being able to see pups. Difficult to see if the room was filled with gas. Okay, fair enough. Right, okay, so I'm going to put the probe on and I'm going to start low down at the bladder. Oh, I don't know. Yeah, you can kind of see. So this big black mass here, that's her bladder, all right? When you're scanning from 28 days, they will be either sitting around the edge here or just afterwards, all right? But there's her bladder. You can see something creeping in here. Yeah, that's a puppy, okay? Now, because she's already in her 40s, we will have bone formation now. So the reason I recommend scanning at 28 to 35 days is they're round. They're like only maximum 1.5 centimetres, 2 centimetres. Okay, and they're not touching each other, so they're easier to count. It's a bit like a dot to dot, and the more skilled the sonographer, the more they visualize the dot to dot in their head, and they add up all the dots that they can see, and that's the number of pups that you've got. And yeah, you can never be 100%. Well, I never bet my life that I'm right with my numbers, but I'm pretty damn close, and most of the good sonographers are. As I say, we can only scan from the bottom up. If we could get round and in and round and all that kind of thing, then we might be a little bit more accurate. but I would never scan 7 and you've got 1. That's for sure. I might be 1 or 2 out, or I might be bang on. But generally, yeah, I would say most good scanners are pretty accurate with their numbers. What's the days best to scan? 28 to 35 days. All right. Most breeds super duper good at 30 to 32. If you can get hold of your scanner on those dates. So I said if you're booking early with them, get them in at 30 to 32 days. Then personally, that's my best date. All right. But yeah, I don't think you're going to see too good, are you? No, that's a shame. Let me see if I can get you closer. You're propped up, so let me get you a little bit closer. That's a good girl, Pats. That's it, it's a little bit closer. Yeah, it's a big bladder. I'm trying to scan looking this way. That's a skill. So as I said, these are further developed now. So I'm going to see if I can, but basically, puppy, there's another pup down here. I'll work my way up. As I say, now they're bigger, they're longer. What we should pick up, this is a skull. A bright white dome is a skull. And they're actually jiggling around. So when you have your scans, you should see them jiggling around when they're in the 40s. If they're even from 34 days, you should see a bright white. Oh, let me see. Yeah. All right, Pats. You should see this white lining. Should I stand still? You should be able to see a white ring, dark fluid, and then the fetus inside, and that's what we're checking. All right. Well, so when I'm checking for a viable pregnancy, I'm checking that it's got a nice thick membrane to it, that the fluid is dark inside, and that there's a white blob in it. Sometimes you can see head and body, sometimes you can see the cord. Just all depends on the dog, and you know, the development of them and what angle you're looking at them from. Okay. But you should be able to see that for every puppy. Sometimes I've scanned an empty sac, so I can't see the white blob. And sometimes I say it might be just the angle I'm looking and it's sitting at the other end and I can't see it, or it might be an empty sac. And actually, most of the time it's actually been an empty sac, which isn't that often, but you do get it. If the lining isn't very thick and if inside it's all sort of grey and murky, then that suggests that that puppy's being reabsorbed. And again, a skilled sonographer will point it out to you, show that to you. I had a lady come to me end of last week, Friday, with a pug that's been having some discharge, and she was a bit concerned because it's sort of dark brown and sort of dark reddy. And she hadn't been scanned yet because we were waiting for the 28 days. Anyway, she was only actually, by the time she got to me, she was 27 days. And I said, yeah, you've got 5 pups. However, I could see that one wasn't looking the same as the rest. And I said, well, that might be the one that's triggering the discharge. So she's decided to put her on a course of antibiotics just in case. She don't want to negatively impact the other pups. And I said, if she gives no more discharge, then take it as all as good. However, if she carries on discharging, then yeah, I reckon it's worth a rescan. So you can pick up things like that. But again, that's a qualified, or not qualified, at least a trained sonographer or experienced sonographer. We pick up things like pelvic kidneys, so where the kidney's not in the right place. That's not too much of a drama for everyday life. There's humans that probably got pelvic kidneys that don't even know it. It's not until you go through something like this that you think, oh, it's in the wrong place. So we can pick up things like that. Personally, my experience with pelvic kidneys, they've never been in pup, and I don't believe they've ever managed to get in pup. From what I read in humans, sometimes it's sort of like that part of the body is not developed correctly, which makes you think that maybe the ovaries might not be right, or the horns and that kind of thing. So I haven't scanned it that often, but when I have, they've never been in pup. Pyo, so pyometra is a classic one where people think, oh, my bitch is definitely caught, she's getting bigger, she's putting on weight, she's changed in her demeanour, she's quiet, this, that and whatever, and actually it's actually a uterus infection. Oh, look at them, Patsy. It's actually a uterus infection, so they're going to gain weight because of the pus. They're they're ill, they're not feeling well, so that's why they're sleeping more, and that would be picked up on a scan straight away, and that's obviously referred to vets straight away. Anything that is a pregnancy, we will always say refer to vets, because we can't diagnose, but at least we can realise when it isn't typical and to tell you when to go. Okay. Can you pick up bladder stones? I've never picked up bladder stones, but I have picked up bladder crystals. So yeah, it's all sparkly and shiny, you can see all the sediment in there, and I've referred them to vet. And I've also picked up where there's been a cyst, so ovary cyst or a cyst within the bladder or attached to the bladder. So we can definitely pick up when stuff doesn't look right, and we don't want to freak people out, but we'll just go, you know, this isn't right. We'll give you a copy of the images, take them to your vet and get them to have a look. But just going back to the pyo, if you ever suspect your bitch has got pyo, don't ever contact a mobile scanner and say, come and scan my bitch. She needs to go like straight away. Don't leave it 2 days for us to turn up and to scan and confirm it. If you think she's got pyo, you need to go to the vet. All right. But yeah, so you want to scan. We're going to scan from the bladder, and it's quite difficult with Pats because you've got 3 puppies there, which you can't see very well. There's a 4th come in. As I say, these are all looking good, which is good for me. Got a set of paws and a body there, so your scanner should be able to point out these things to you, and they should be scanning all the way up to the spleen. Okay, and as I say, you should be scanning down the middle, down one side and down the other side. So you're having a good look round of what's going in. Okay, I have scanned down, I will share the images, but I'm expecting 7, possibly 8, so we'll see whether we're right with old Patsy. So this is one, as I say, she was I mate immediately day 9, I mated her day 10, and we're expecting 7 straight 8 puppies. And she's actually showing quite sooner than I thought she would do, actually. But she's coping well, so she's doing all good. But as I say, it's quite hard. I'm sure you can't see the images a bit better, but they should be talking you through what they're doing. They're looking at the bladder. And what's harder for us scanners is breaking the news that they're not in pup, because sometimes people don't want to believe us. So I always, particularly when they're not in pup, always go, this is the bladder, this is the baby space that should be afterwards. There's no babies, this is just bowel and gas. We're going to check all the way up to the spleen. They're not going to carry anything past there. We're going to check all the way back again. Because people are, oh, if you're sure you haven't missed it and all that kind of stuff. Well, if the person's good at what they do, then no, we won't miss it. Okay. But right, so I'm going to put Juna on because I think she might be slightly easier. But feel free to ask any questions just while I swap them over and hopefully not knock you over. But everything's going well with Patsy. She's got a good size litter. Obviously, the benefits that I've got as a scanner, I can check them if I was ever in any doubt. Actually, people do ask me, is it worth scanning again after you've done the initial scan? And I could say, oh yeah, and take more money, but personally I just go, if they're growing, they're getting bigger, they're happy, you've not got any any bad discharge that you're concerned about, I wouldn't bother. I wouldn't waste your money. If you've got concerns, then yeah, scanner again and just check that the pups are doing all okay. Once you get into the 40s, mid-40s, you'll pick up heartbeats really well, really clear fluttering of the heart chambers, and I've posted some videos on my page previously of this. But I never really recommend rescanning, because again, like this, they're already getting too big. You can't fit much. You'll get to the point where you can't fit a whole puppy in a view, so you're only seeing parts of. So personally, I don't see the point of it. Okay. Do you rescan if not in pup? No, I don't. But you might have missed what I said before. I did have one bulldog that I confirmed not in pup. She was a fixed set bulldog, me scanned at 28 days. And then they sent me a picture of her teats and they were huge, and I said no, bring her back, because either it's a really bad phantom or something's not right, basically. Yeah, she's in pup. Anyway, we scanned her again, and even then, and she, yeah, it was obviously late 40s, early 50s. We did find one pup right up by the kidney. So I said it's very unusual. If it's a small litter, 2 or 1, that always they're down low, they're never up here, but she was actually right up at the end of the horn, right next to the kidney. So I was scanning, and that's another thing, people scan kidneys for puppies and they're not. But yeah, she was right next to the kidney, or the puppy was right next to the kidney. Anyway, they did what they needed to do. She ended up being C-section because it was just one pup and didn't kick everything off. But unfortunately, was just where she was positioned right next to the kidneys, just wasn't a favourable place to be. If it had moved down, and then it probably would have been viable. But generally, I say no. There's no. I'm quite confident that no, she's not in pup. And if the people aren't lying about their dates, because you do get some people that get impatient and they tell you they're 28 days and they're really 21 days. Then if you scan at 21, it's not accurate. So yeah, then I would say if someone's telling porkies, they need to rescan. Caroline, yes, I definitely will. I've got your details. It was just because I've got to work out when these are due and I didn't want it to clash, so I will be in contact. How often do you scan nothing and still there was puppies? Once. And I've done 1,300 dogs and there was one. So again, it's how good your scanner is, really, at doing that kind of stuff. But generally, that's what I'm saying. If people don't lie about their dates, so if they're ovulation testing, they know their dates are their dates, then you can't be wrong. But if people haven't ovulation tested, they still could catch 5 days after their last mating, and then you could be, and if you're scanning at 28 days, you're only really scanning at 23 days. Okay, so you could be out then. Right, I'm conscious we've nearly gone on an hour, so let's get Juno up quick and we'll scan her, and then any questions, ask them, and then we'll wrap up. But I'm going to do another one on stud dogs anyway, and obviously I'm going to update you as these go along as well. Okay, but let's put Juno Patsy down. Yeah. Oh, you stay there, Patsy. That's it. Stay. That's it. In there. That's it. Just. That's it. Get in there. Right, so this one hasn't really, I don't think she particularly enjoyed motherhood the first time, so she's pretending she's not again. So when I scanned her, I thought there's no way she was, because she is quite, and she's right at home, but when she's out, she's a little bit nervous. And actually, she was doing a lot of humping, like 3-4 days after I mated her. So I was thinking, oh God, her body was out of sync with what the bloods have said. So I wasn't too sure. Yeah, that's fine. But again, goes dark. We've got bladder. She's actually a harder bitch to scan, and there's no rhyme or rhythm, but I think it just depends on their tone, abdominal muscle strength, fat ratio, that she is just a lot harder to scan compared to Patsy. Patsy's a much finer bitch. We've got bladder here. We've got a puppy coming in here. As I say, you've got another one over here. So this is classic white line, dark fluid, blob in the middle. Okay. But she is a harder, and that's the thing, you don't know, there we go, that's slightly better, you can see, hopefully there, not too great on the screen. So I've scanned her for 3, maybe 4, yeah, 2 there next to each other, and one comes in there, the other one's on the other side, is it, oh yeah, over here, yeah, so that's a nice typical picture. You can't see that well, but nice thick lining. You can actually see head and body developing on that dark fluid. So it's looking really good. So yeah, so for Regina, which I'm really pleased with, because on her first litter, as I said, she only had 2. So I'm quite pleased that I've doubled my number with her. I did vitamin E in both of them. You can tell, look, she doesn't look impressed at all. She hasn't even moved. Oh, Juna, it's not that bad. Juno's right. Let me just push you back a bit because it's squashed in. That's it. So yeah, so they're both in pup. So it just goes to show proof is in the pudding. I did my bloods. I think we did 3 bloods with both of them just because I didn't know where Juna was. So I think I did catch her on like day 1 or 2. So she probably had 1 more blood than she needed to. And Patsy, I was just playing it cautious actually. So I did her on day 1 because I wasn't sure. So they both have 3 sets of blood, but they're both in pup. Juna's got 4, I'm hoping. Double what she had before. She only had 2 in her first litter. Patsy's maiden, and so scanned her for 7/8. So hopefully I'm going to be busy. They're due 4 days apart. So hopefully all goes well, but I will keep you updated. I'm going to talk you all through like my puppy pen setup and why I do it that way. I know different breeds have different setups. I mean, Jill with her Danes, God, the size of her whelping pen probably take up my whole lounge. But just what some of the considerations to think about, regardless of the breed, just some of the considerations to think about with your whelping setup. And again, I'm going to cover the stud dogs, which I haven't done yet. And I've got a few other bits and bobs that I want to cover with you as well. But yeah, so I'm going to be busy. Everyone's got babies, which is what we want when we decide to breed. So if there's no more questions for me, then I'm going to log off because I can't believe that I've taken nearly 56 minutes of your time yabbering on again. But if you think of any questions between now and then just let me know. What I am going to quickly do, though, is post a link if Juna doesn't fall off the table. Quickly. Just to the supplements. Oh, it's going really slow. I'll post it afterwards, but I'll post you the link as soon as I've done here. I'm going to post you the link to the supplements to buy the vitamin E and the folic acid. Any questions about the progesterone testing, as usual, just contact me. Otherwise, I'm going to log off. All right, no worries. Speak to you later. Bye.